I'm live on TikTok and I'm live on
YouTube.
Hello, it is Tuesday. It is Tune In Tuesdays. I look terrible on YouTube. I don't know what's going on with the lighting. The light is pretty good for TikTok. So, okay.
Excuse me.
We normally go, for those of you that don't know me, I'm Dr. Tara Scott. Dr. Tara, your hormone guru. I'm a traditionally trained OBGYN who is on TikTok to help educate and advocate for you guys. So, like I said, I've been doing this hormone stuff today I did a podcast, which for any of you guys that are interested in the Desire Revival Summit, I just recorded my interview with sex therapist Heather Shannon, and she is doing those summits work. They're free. They have like 10 lectures a day. You listen to them, and then if you can't listen to everything live, you can always, for a nominal fee, purchase the recordings. I've never put on a summit, but if you are not subscribed to my newsletter, click in the bio, click to subscribe to the newsletter on YouTube. It should be in the comments. We are going to be sending out the information about this summit. I think the summit is live on September 22nd, but Desire Revival, my last few emails on libido have had like an 80% open rate. And also my last few topic videos on libido and all the different hormones and all the different things that affect your libido have garnered some interest. So, but I'm here today as a doctor, but not your doctor. I can't give you medical advice, but I can hopefully answer some questions, point you in the right direction, give you some insight. So I'm happy to, for the next 30 minutes, entertain some questions. It doesn't have to be about female hormones. It doesn't have to be about menopause. It can be about teens with acne. It can be about anxiety. It can be about PCOS. It can certainly be about libido issues. So I'll just wait till the first question comes in. But wanted you guys to know that we do have a free course. We do have a lot of free downloads, testing guide. Everyone's always asking about testing. Today I filmed a bunch of videos, lots of questions on testing, what to test, how to test. I thought we couldn't test. I thought testing means nothing. So it's a very nuanced approach. And as I mentioned, did I mention I've made it my life's work for the last 20 years? Since 2003, 22 years, I have been doing hormones, hormone guidance, learning about thank you for the gifts, whatever it's, still not really sure what that means, but I have been treating women and their hormone issues. And now remember, I'm a traditionally trained OBGYN. I also delivered babies, did hysterectomy. I love that. Love doing obstetrics, but really found that there really wasn't anybody who was focusing on hormones because of my own infertility and my own hormone issues and my endometriosis and my Hashimoto's thyroiditis. It really led me down the path to learn more. So if you guys have questions about thyroid, about stress hormones, about male hormones, about female hormones, I will start as soon as the first question comes in. Just a word of caution. I have seen a couple people say, why are you skipping my question? If you have a certain word that TikTok doesn't like, it filters out the question and I don't get it. So if you're hearing me, I'm going in order and I'm not answering your question, then just think about the words that you're using and post another one. So if you're just joining in, why don't you guys let me know where you are joining in from? And also, if you're menopausal, postmenopausal, or taking hormones, put that in the comments if you're willing to share. There was that trend going on, a post your patch, so I posted what I take for hormones. So if you guys are comfortable sharing, let me know where you're listening from. Let me know what your struggle is. Let me know what your questions are. For those of you kind of an orientation, I'm here on TikTok. I've got so much content. It's a little bit better searchable, but it's really hard because I literally have over 1,000 videos. So head over to my YouTube channel, Tara Scott MD. You can also find me as Hormone Guru. I think it's a little bit better searchable format. I'm also on Instagram as Hormone Guru MD. And as I mentioned, we have just revised our site, Dr. Tara Scott. We have a free download for natural therapies for antidepressants. We have a free perimenopause testing guide. We have a free hormone course. And then we have like a more in-depth course that is a nominal fee. Cindy says, oh, yeah, I know. So I get a lot of questions about how patients can work with me, and I have to follow the laws of the medical board. It's not really my law. For doctors, whatever state you're licensed in, you can only see patients in that state. And in Ohio, we have to start care with the face-to-face visit. So that means people have to come to Ohio first. And then after that, for a year, we can see them virtually. And in my practice, I have two nurse practitioners and a physician's assistant. So I have other providers. And also, I'm not at Cleveland Clinic, but very close to Cleveland Clinic, about 35 minutes south of Cleveland Clinic. And just as an aside, I opened my practice before Cleveland Clinic opened their functional medicine practice. But I am part of a bigger network called Forum Health. And there are, I think, 30 or 40 sites. Not all of them do hormones to the level that we do, but they're all integrative in functional medicine. Hi, Lauren. Thanks for joining from Chicago. Started BHRT of estrogen patch and progesterone. Yes. I've seen that some people have started at the middle dose. So I'm wondering if you're at the 0.025 dose. That might be the bloating. The bloating also, remember that your bacteria in your gut does change with the lack of hormones and the institution of hormones. So that could be something that would settle out. But Lauren, I'm so glad you are on bioidentical hormones and you have found a provider to help you. Cindy, you have to do 2 patches to get my levels up, 0.1 and 0.025. You know what? It's interesting because there was just a study published in February in the Journal of Menopause about this exact situation about people who don't respond to the patches. And I have one patient who was the same thing. We went all the way up. That 0.1 is the highest dose patch, and then you're adding a 0.25 patch. I just recently changed that patient to a gel, and her levels have gone up. Now, gels don't always raise your blood levels, so we did a saliva test on her, but symptomatically, boy, does she feel better. So think about that, Cindy. If you are not getting the response that you like from the 2 patches, that might be you just are not someone who is absorbing the patches. And I like Divigel is the brand name, estradiol gel is the generic. It has 0.25, 0.5, 0.75, 1, and a 1.25 gel, daily gel. So that might be something that you can do it. Meme, is it normal to have menopause at 41? No, that would be considered premature menopause. And the data shows that people who have menopause at 41 absolutely have more risks of heart disease and should take hormones at least until the age of natural menopause. Why Smitto? What can I take for perimenopausal anxiety? A couple of things that might be good for that. Magnesium in the form of neuromag. You might see it as magnesium L-threonate. Sometimes, depending on your biochemistry, 5-HTP might be something that would be good for you, or L-theanine, or sometimes my patients take something called pharma-GABA. How do we know if our detox pathways are in good shape? Lauren, that is a great question. So the first 2 pathways of any detox for anything is your liver. So one general way is to look at your liver function test. However, your liver function test could be what we found out with my partner is his liver function tests were normal, but on scan, he had mild fatty liver. So there's the AST and the ALT, and then there's a more specific GGT that's not on the normal liver profile that is more, is going to be elevated. We like it to be less than 40. If it's higher than 40, you're having some problems with toxins. The third pathway of detox is pooping. The normal pooping is twice a day. So not a lot of people do that. All right. Cindy, you dried the gel, and in a week, my body didn't like it. Interesting, Cindy. I wonder if they overshot the dosage of the gel for you because some of the gel doses are pretty high. So I'm just wondering. SoCal Charm, I started a Combi Patch 3 weeks ago. I had some initial bloating and cramping, but not anymore. Okay, so the Combi Patch is bioidentical estrogen, but it's not bioidentical progesterone. It's a synthetic progestin. Some people do fine with it, and they like it because they don't have to take a pill. So keep an eye out, SoCal Charm, for breast tenderness, weight gain, and maybe mood issues. Sophia and Milo, is it normal to have brown spotting 3 to 5 days before your period? So a lot of times that does tell me you could have a low progesterone. So it's not uncommon, but it could be a signal that you have a hormone issues. Meme, do I see a GYN or get a referral to an endocrinologist? So Meme, you're not going to get, I do not think, at least in my area, endocrinologists don't see menopause. I would really suggest maybe starting with your GYN, at least getting a bone density, because with premature menopause, you really want to see someone and ask your provider, what is your experience with hormone therapy? Do you feel like, or have you had extra training in hormone therapy? And can I is that something I can work with you for? Or is there somebody that you trust that you can refer me to? Another place to find menopause practitioners is either menopause.org. Those are going to be traditional providers, but they're not afraid to use hormone therapy, but they may not check some labs, or A4M. A4M.org is you have to go to provider, find a provider directory, and you can find someone there. Okay. Golden con, what could cause estrogen to be low if not perimenopause? Progesterone is normal. I'm 37. That's a really great question, Golden Con. Like, so it could still be egg quality. It could also be something else like mold. It could be also something like heavy metals. It could be something like gut issues. So yes, even though you're 37, I had issues with my estrogen, early. So, and I had infertility. So that could be it. Cook, I had gastric bypass last May and last 9 months and have been messing me up bad. Yeah, yes, it's going to affect your microbiome, which your microbiome is directly related to how your body processes estrogen. That's the third step. Also, it's going to affect how you absorb things and your nutrients. Your nutrients, especially your B vitamins, are integral in how you process your hormones also. So usually they're pretty good with a gastric bypass. Okay, user 285. Funny, thank you. Actually, I don't have a husband. I have an ex-husband, and he did not think he was the luckiest man alive, obviously, because he left. But anyway, whatever. My boyfriend is the luckiest man alive, though. So thank you. If we can't see you, who do we recommend? Okay, Cindy, go to the directory at a4m.org, put in your zip code, go find a provider, and look for someone who has done training in hormones. What does it mean if my period went from 5 days long to 2 to 3 days, 39 years old? So at that age, at 39, you can expect that all the good eggs are gone, and you might occasionally have one cycle that you have a different amount of estrogen. So if it's just something that happens one time, I don't think it's necessarily something. And Free Gaza, I wonder, when did you have your blood work done? So you're saying your blood work is normal. So when did you actually have it? Was it a specific day of your cycle? Because if you didn't get it the right time, it might not have been normal. SoCal Charm, I'm also using compound testosterone. What are the benefits of adding progesterone? Okay, so progesterone in your body, from a traditional standpoint, there are some people that think you only need it if you have a uterus. You do have a uterus, that's why you're taking a synthetic progestin. So it's like glucose and a Splenda. They're not the same in your body. So progesterone in your body, SoCal, is an anti-anxiety, is a sleep aid, is a diuretic, has some bone health benefits. You won't get those things with a progestin. Progestins are associated with an increased breast density, increased risk of breast cancer, increase problems with insulin resistance, and also depression. So if you don't, not everybody has that. If you feel fine, I don't want you to worry, but those are things that synthetic progestins are associated with. Okay. Let's see. Lauren, I had to see 3 doctors to find one that's listened. Yes, because my periods are regular. I just did a video on that. You don't have to have irregular periods to have a hormone issue. And so, Lauren, I'm so glad that you were persistent in finding you. That is part of the reason I'm on TikTok, to advocate for you. So I'm so glad that you finally got support. Things have changed a lot in the last 5 years just since I've been on this app, because before we had social media, we didn't have all this, didn't have all this access. All right, one doctor on here says estrogen only HRT is dangerous. I agree that I do not use estrogen only. Now, that is where it gets confusing, because there are a few studies that are smaller amounts of people for a shorter amount of time that have shown that estrogen only is not a problem. One of them is the WHI study, and another one I'm blanking on. But if you look at some of Avril Bluming's work, and a study that was Chlebowski or something, I'm blanking on the name. It was just published that said estrogen only had a decreased risk of breast cancer, but estrogen only was not compared to estrogen plus progesterone in those studies. Estrogen only was compared to estrogen plus progestin. So what that meant is if you give estrogen only compared to estrogen plus progestin, there's less breast cancer. It's more favorable, but I'm not comparing it to a progestin. We already know that the progestin has an increased risk of breast cancer. I have not yet seen a study that shows estrogen only compared to estrogen plus progesterone. So that's the study I want to see. But I personally do not give my patients estrogen only. That's me. I've done a lot of videos on that topic here and on YouTube. Lizzie, using Climera Pro and an estradiol patch. Okay, so Climera Pro, which is estradiol plus progestin and estradiol. So Climera Pro, as far as I know, I think only has 2 doses. So maybe you need more estrogen. But wondering what your symptoms are, Lizzie, that's causing you to feel like you need more estrogen, because that's the other problem is some of your symptoms can be from the progestin and the lack of progesterone, and you keep increasing your estrogen, but that's not really the issue potentially. Okay, Blackheart, metformin versus GLP-1 thoughts. I have hyperinsulinemia and insulin resistance. So let's do a deep dive into the 2 of them. And actually, that's a really good topic for a video. I should do that. Okay, anyway, so metformin sensitizes your body to insulin at the cellular level. Okay, it also depletes your B vitamins, and it's an oral medication. So a lot of patients have a lot of GI upset, diarrhea, sometimes constipation, sometimes nausea. It's a very cheap pill, usually 0 copay or covered by your insurance, and it works. It decreases your fasting insulin, decreases your A1C, and very cheap. Because it decreases insulin, there's some people think it has a lot of anti-aging properties, but in actuality, it's just decreasing your insulin. GLP-1s, so how they work, first of all, most of them are injectable. There's a few oral on the market, but most of them are injectable, some once a week, there's a couple that are every day. So when you eat, your blood sugar goes up. Then insulin goes up, right? And then your blood sugar goes down. Then glucagon goes up. So what happens is glucagon-like peptide, it's blocking that yo-yoing in blood sugar. When you have high, some of the time, people with high insulin have a low blood sugars, and they have to eat because it's more dangerous to have a low blood sugar. So both work great. In my practice, I have patients that we've prescribed both of them to. So it's a patient preference. It ends up being, do you want to give yourself a shot? Can you afford it? Will it be covered? If you don't have diabetes or you don't have a BMI above 30 or maybe even more than that, it's not going to be covered, the shot. Metformin will be covered. And sometimes you have to even have to show that you failed metformin. So both are great, in my opinion, for hyperinsulinemia. Okay, Cindy, check out the directory and see maybe if you can find a doctor to work with you. Josie Scott, my cortisol is really high right now. Girl, where's your meditation? Where's your music? Where's your pharmagaba? Do you still have any of that? You should be taking that. And if not, I will send you some. I got you a little, what is that? Is it what kind of stone that's a cat? What's the stone? Do you remember the pink stone? Rose quartz. We got you one from Sedona that's supposed to help your stress, and it's in the form of a cat. I need to mail it to you, and you can just hold it, and it's supposed to help your cortisol. Sylvia, what hormone testing? What should I ask for? Sylvia, I will go through this, and also please check out our free download about perimenopausal testing. Okay, I think it's just hormone testing, maybe not just perimenopausal. I would ask to be tested between day 19 to 21. Day 1 is the first day of your period if you have regular periods. If you have irregular periods or you haven't had a period, you can go any day. We would check an FSH, an LH, a free thyroid, TSH, free T3, free T4, a testosterone total and free testosterone, and a sex hormone binding globulin, a dihydrotestosterone, a DHEA, a DHEAS, a progesterone, an estradiol, and an estrone. So that's all listed in our free download. So if you guys want to find out more about testing, please go to my bio and click our download. Sign up for our free newsletter. Okay, user 518-207-929. I have heavy periods, PCOS. My doctor pushes birth control. Yeah, I know. I treat my PCOS patients sometimes with metformin, sometimes with spironolactone, sometimes with just cyclic progesterone. 2 of my favorite supplements for PCOS are inositol 1 gram twice a day and Vitex. Chronic Health True Love, could high hemoglobin and hematocrit with low ferritin be hormone related? High hemoglobin and hematocrit could be dehydration. Low ferritin, I want to know what your iron is, Chronic Health Truth. Your ferritin is the storage form of your iron. So iron is an acute phase reactant. It could be abnormal if you have a latent infection like Lyme, like EBV, like Bartonella, Babesia, all those infections. I'm not an infection specialist. I just know this because some of my hormone patients have this issue. So definitely I would do a deep dive in that. Stacy, my imaging shows adenomyosis and endometriomas. Hate the idea of hormone therapy. Any thoughts? Yeah, Stacy, you should see an integrative specialist. You would really benefit from figuring out how your estrogen detoxification works. But in the absence of you being able to do that, NAC 600 twice a day. There's some great studies on that, and endometriosis. DIM might help you, maybe not. Resveratrol 500, I think, is a dose. Don't quote me on that. Those are some things. Nina, I'm on a GLP-1. Can you take HRT? Yes, we have many of our patients on at the same time. In summary, which do you recommend for high insulin with low blood sugar? Blood sugar is going low. Well, I do always give the patient the option, and I'm a practical girl, so I would have my patient try metformin because it's cheap and it's less side effects. And if it works and they have no side effects, it could be a very easy fix. I do love the GLPs for our patients also, though. Okay. User 51820 saw I heard natal 1 gram. What was the second thing? Okay, what were you? You the PCOS patient. Inositol. Inositol, 1 gram twice a day, and Vitex. Is there anyone who should not take Vitex? Great question, Blackheart. So Vitex is chasteberry, and what it does is work with the connection between your head and your ovaries to try to get you to have a more robust ovulation. It is not progesterone. It does not agonize the progesterone receptor. It does not necessarily equal progesterone. However, younger people, let's just say 40 and younger, could really benefit from taking Vitex for irregular periods. Now, it's not going to hurt you if you're over 40. It just may not work because your eggs are old. Okay, on YouTube, where are all the questions coming from? Yes, I'm going simultaneously on TikTok. It seems like more people joining on TikTok, but on YouTube, then we have the recording that people watch later. So that's where I'm reading the questions for. But you are more than welcome on YouTube to add a question here as well. But the questions are coming. Okay, what about cortisol during perimenopause? Kraus 1023. Yes. So I have yet to really meet a person, especially after COVID, that has normal cortisol. So it's an integral relationship. Cortisol affects the way your thyroid works. Cortisol affects the way that your estrogen is metabolized. So we like to check it in most of our patients unless they can't afford a cortisol test. Now, we will also check it in the blood work at 8 a.m. It has to be between 8 and 9. It has to be fasting. But that's only part of the story, so it's not a full evaluation of cortisol.
Did you read one from YouTube that talked about where you get the questions?
Yeah, I addressed the one on YouTube. Bridget, I started estrogen boost with 20% progesterone. Can I use it all month? I'm not sure what that 20% is unless it's 20 milligrams and you're getting it compounded. We usually will talk about things in milligrams, and I don't know what estrogen boost is. So thank you for those of you guys that are following me. Okay, Kristen CK, what is NAC? N-acetylcysteine, it's just a compound. Cysteine is an amino acid. It's a building block. N-acetylcysteine is a building block for something called glutathione, which is kind of like your body's vacuum cleaner. It just detoxifies a lot of things. Okay, sorry. I don't know what the hearts are, but thank you. Thoughts on an 8 millimeter nodule found. Joseph, where is the nodule found? It just says nodule found. Cindy, what do you find works well for low ferritin? Mine was 11, just had iron infusion. Yes, iron infusions are good. I like Mary Ruth's, I think it's called Blood Builder. Or she also has a liquid iron. I feel like patients do a lot better with liquid iron. If you want to do a capsule, ferrous bisglycinate is what we recommend. The Peri download link isn't working, Sassy Boots says.
What's not working?
The testing download. Thank you for letting me know, Sassy Boots. We will check it right now. Okay. I can't see what your icon is. Maybe a bird. Just started taking 250 milligrams a month. Oh, testosterone. 250 milligrams a month. Now, are you taking that? First of all, I cannot see if you identify as a male or a female, and I cannot see, is that a injection? So the dosage matters based on if you are identifying as a male or female, or whether it's transgender hormone therapy. So 250 milligrams a month. Divide that roughly, that's about 1 milligram a day. If you're doing an injection, wait, no, 10 milligrams a day. That's more of a male dose. So if you are a female, that is a high dose. And so probably a blood level can be good. Okay, high SHARP. So I have a patient, same thing, high HS, high sensitive CRP, C-reactive protein. That is a very sensitive indicator for um, inflammation in the cardiovascular situation. Okay, so you really want to look at anything that could be causing inflammation. Cortisol, could it be food? Could it be infection? Could it be stress? Could it be, and mostly at the time is food. So in the absence of that, some good anti-inflammatories are turmeric. It's also CoQ10 is something that is good. Boswellia is something good. Click on the download. Is it working? Download. Okay, so maybe it's the link in
Was it somebody on
TikTok.
YouTube or was
Somebody
it on
on
TikTok?
yeah,
You
somebody
can paste
sassy.
the link.
So Sassy Boots is that maybe the link. I'll check the link, but go to Dr. Tara Scott directly to the website because it looks like we just checked the website and it is working there. But I'll check the link here. Thank you for letting me know. Back to the question of HSCRP. So turmeric and turmeric plus boswellia is something that I really like, but I really would go on an anti-inflammatory diet. Shannon Mullen, any natural supplements to support hormone health age 58? Yes, fish oil, probiotic, magnesium, vitamin D, and sometimes a B complex. Those are like your basics as far as hormone health. Let's see. Okay, insomnia. I have insomnia, and doctor says it's because my testosterone's at 75, my hemoglobin and hematocrit high. So Tina Osborne, again, I'm going to assume that you identify as a female, and that is a high level for a female. You will see a high testosterone for somebody who is not ovulating properly, and then along with that becomes estrogen out of balance from progesterone. So I'm also wondering, where are your periods like? And usually insomnia is from low progesterone. Okay, male in a week. Okay, it's IM injection. Okay, thank you for clarification. Okay, so you're taking 250 milligrams a week. IM injection. So 7, that's a hefty dose. So testosterone cypionate comes 100 milligrams per ml and 200 milligrams per ml. I'm also wondering, little bird icon, if you are on cypionate or propionate, because okay, think about it this way. When I think about testosterone, first of all, I think about the half-life. Testosterone cypionate, which is one of the most common used for males in injection, which comes 200 milligrams per ml. So if you're getting 1 ml, you're getting 200 milligrams. And that half-life is 8 days. So that means that 8 days, you still have half of that 200 milligrams circulating, which is 100. So if you're doing a weekly injection and you're doing 250, and again, I'm not really sure, you can accumulate. So I do think you should probably get your levels checked. Also, keep in mind that high testosterone causes testicles to shrink. And if you want, maybe you don't care about the size of your balls, but maybe if you want future fertility, it's going to impair spermatogenesis, like the creation of sperm. So I'm hoping that you are also maybe over 45 and done having kids. There's a different protocol for somebody who is low. So Jen, you're kind of piggybacking back on this question. So in my practice, we do treat males. I personally choose not to see men because I have spent so long seeing women as an OBGYN. I'm very awkward talking about penises. That's really the real reason. It's not that I can't treat men and I'm not qualified to treat men. I have a couple male patients that I see that are husbands of my long-term patients. But yes, in my practice, first of all, I teach about treating males and we do see men. Okay, Superwoman, I love the name. I get constant headaches and bad migraines just before the cycle. I tried bioidentical hormones. Wondering what you took, Superwoman. For somebody like you, I would think it's either your DHEA that's low or your progesterone. I'm hoping they didn't give you estrogen because I'm not thinking it's an estrogen issue. Maybe that's why. Okay. Thank you guys for following me and signing up for our newsletter. Can you explain the connection of hormones and the microbiome? Yes, Ardit, I can. Okay, so think about detoxification. If I'm cleaning my floor, let's explain it like that. I'm going to sweep my floor and then I'm going to mop my floor. That's a two-step process for me to clean my wood floor. And, and then maybe after that, I might have a Roomba coming along behind it, right? So phase 1 and phase 2 are in the liver. Those are enzymes. The first one is a cytochrome P450. It is genetically coded to maybe work fast or slow. The second reaction, it depends on if it's testosterone, if it's estrogen, if it's a fat soluble vitamin, if it's a toxin. The second step will either be a second, I'm probably going into too much detail, methylation, glucuronidation, sulfation, anyway, chemical reactions. After it goes in the liver, think about putting in the box, tying a bow, and going down a slide into the gut to be pooped out. That's phase 3. In there is the microbiome. When you have too much bacteria or the wrong kind, they are going to produce an enzyme called beta glucuronidase. When that is high, it's like that box gets opened and the estrogen conjugates can get sent back into the circulation. Now, that is a good thing if you have low estrogen to get some recirculation, but if you have high estrogen, it's not a good thing. So there are some studies now that we're finding more and more of the microbiome that can be, is it the cause or is it the effect of the hormone issue? Cindy, thank you for your kind words. Miriam, how does omega-3 impact hormones? So omega-3 is an anti-inflammatory and also it helps encourage good detoxification of estrogen. Is it worth testing estrogen in perimenopause with no period? I don't know if I'm observing estrogen HRT gel. Yes, I do. I believe it's always worth it, Purple Heart. And also let me caution you that estradiol gel doesn't always raise levels in the blood. Sometimes it will, but sometimes it's hard to metabolize there. Does progesterone help with hot flashes? So yes, it can. Ninjas, what I see more often is night sweats. True, just hot flashes, there can be a little bit of help, but those are usually from from low estrogen. Okay, CYP, CYP, cytochrome P450. Yes, you sound like you know what I'm doing. Okay, details. I've been following you and doing everything you suggested. Yay, thank you. And your husband's a physician. Yay, I hope he's open to this kind of medicine. PT, do you use intravaginal estrogen in conjunction with progesterone? Great question. You guys are asking some great questions today. Okay, so progesterone is DHEA. Now, again, please tell me if I'm geeking out too much on the science, but I always think it's helpful to have some background and context for why I'm saying what I'm saying. We have the most studies on estradiol or estrogen in the vagina. When the vagina forms in utero, there's two tubes called the Mullerian ducts, okay? Like pretend like I'm a uterus and these are fallopian tubes, okay? And there's a division between those. And then the lower third of the vagina comes from something called the urogenital sinus. The reason I'm telling you all this detail is because those different parts respond differently to hormones. The top responds to estrogen, the bottom responds more to testosterone derivatives, as in DHEA. So if you're having pain with intercourse, pain and burning with urination, just like dryness when you wipe, progesterone or DHEA will be better. If you're someone who has deep pain with intercourse and your doctor does a exam and you lose your what's called rugae, so it's kind of a weird joke that when you age, you lose the wrinkles in your vagina and you gain the wrinkles in your face, but whatever. So when you lose the rugae in your vagina, that's a loss of estrogen. So that is how I used to decide as a gynecologist which one was better. Now, DHEA has been studied and has also helped all 4 phases of the sexual response cycle: sensation, desire, climax. So I really prefer DHEA, which is progesterone. So I don't know normally PT need to use estradiol in conjunction with progesterone. D. Tellis, thank you so much for your kind words. I really appreciate that. Okay. Sorry, you did not answer on CRP. I did answer it. I said what my favorite anti-inflammatories for high CRP is. I really think you should consider an anti-inflammatory diet, which is cutting out processed food, lowering sugar, decreasing or eliminating alcohol, gluten, and dairy. That's an anti-inflammatory diet. I would love turmeric with boswellia. I recommended yesterday a patient that had a high CRP is something called Inflammatone. It's by Claire, maybe. I think she could get it on Amazon. So I also said CoQ10 could be good for you. Okay, is estrogen showing up in blood work an accurate measure of absorption? That is a great question too. That's the dilemma. How can you accurately measure absorption from the gels? And I can tell you there have been studies looking at all of this. And I actually did a study with the guy who created the Dutch test. And we had a patient that took estrogen by patch and a progesterone pill. And for 5 days in a row, we had her do blood, urine, and saliva every day. And then the last day, oops, I just fell off. The last day, sorry, we had her check her blood every 2 hours after getting the blood run. Then we had her do an estradiol gel and a progesterone gel. And we did the same thing, blood, urine, and saliva every day for 5 days, and blood every 2 hours on the fifth day. Okay. So the findings were really interesting because with a certain gel, you will eventually, at a certain dosage, see a high dose. Okay. And again, I don't want to geek out on this because half life matters. If you are taking a drug that has a half life of 24 hours, that means the next day half is still hanging around. If it has a half life of 10 hours, that means at 24 hours, it might already be gone. So that also has something to that. Oh, so Detail says, oh, okay. Yes, he's a surgeon. He agrees. Okay, awesome. So I do miss operating. I'm so glad to hear that he is. I'll have to look him up. I don't know if he's on here, but I'm always so thankful to people who are interested. Okay. Oh, so you're saying the loving the geek out. Okay. We were struggling and he didn't know how to help me either. Oh, thank you so much. That made my day knowing that the time we spend on here is helping somebody. Okay, what is your usually starting for dose for testosterone injection in women postmenopause? Okay, so if I'm using something that's commercially available, my preference is to get it compounded 50 milligrams per ml and start with zero point 0.1 ml, which would be it would be like 5 milligrams per week because the ovary produces about a third of a milligram a day as a female. As a male, produces 5 to 7 milligrams a day. So we're trying to be somewhere in between there, right? To start. However, I usually have to use 100 milligrams per ml and use zero point 0.1 ml. So zero point 0.1 is about 10 milligrams. So I would probably start with once a week and go with symptoms. Okay. Now, when you're testing injections, you have to do kind of two blood works. The day you give the injection, and then maybe 5 to 7 days after. So at the very, very latest amount, which we call the trough or the lowest it's going to be, and then again after the injection. With an injection, it's going to go up and down. So it's a little bit nuanced, but we can make it work. Okay, KK just turned 35 and scan shows zero point 0.2 mH, no children. I'm so sorry, KK. I will tell you that the AMH is only supposed to be studied to predict how you would respond to infertility drugs. I have had patients that have a very low AMH that still conceive naturally. Okay. Having said that, what are other causes of low AMH? Look for a yeast overgrowth that we test that in the blood. Look for heavy metals. Make sure you don't have any mold that you're exposed to. Get your hormones checked. Clean up your diet. There is a supplement called by Needed. I think you can get it on Amazon called Egg Quality Support or Egg Support. That may be helpful, KK. We see people and do kind of an infertility workup. We don't give infertility drugs, but we look for all those things in our practice. I have a few people that have low AMH. I don't know if anyone is actively trying to get pregnant or not, though, so I can't say that they have gotten pregnant. Pretty girl, does progesterone cream raise levels same as pill? No. The levels don't react the same. Okay, so when you put a cream on, guys, You're putting a cream on your skin. It's going to go through your skin. It's going to go into your sub-Q. In your sub-Q, you have capillaries. It's going to get into the capillary. It's going to hop on a red blood cell. And the studies have shown it's on that red blood cell for about 3 seconds. After it goes on that red blood cell from your arm or your leg, it's going to go to the tissue. Once it gets to the cell, it's going to get out of that capillary into the tissue, right? It's going to get into the uterus. It's getting into the breast, into the brain. It's going to get into the cell in whatever tissue it's in. After it has its action there, it doesn't hop back into the vein. It goes and it's drained in the lymphatics. That's why in the tissues are drained in the lymphatics. It doesn't all go, let's get back into the vein. The vein is coming from the liver, from the intestine. So anything pill-wise is going to be in the veins because it's going from the liver. But anything cream-wise doesn't necessarily do that. That's why. Banana nut muffin. What do you make of high AM and PM cortisol, high DHES, and barely elevated testosterone? Sounds like you have a lot of stress. I would highly recommend you finding something that works for you as far as meditation, yoga, breath work. Okay, so is the estradiol patch better than the gel? Ninjas, there's not one that's better. It really depends. Everybody acts differently. Some people, I love the patch because you stick it on, it gives you levels. But what we're finding as we saw some people on this dialogue, they don't absorb the patch. So they absorb the gel better. So it just depends. Like, do you like wine or vodka? They're both alcohol, but how do you absorb it? One might affect you differently. They're both alcohol, but you might have a preference, right? Okay, Cheeto the Magnificat. Will metformin affect my HRT, estrogen, progesterone, testosterone? Well, in the sense that it will help your insulin, it's not going to be a negative effect. If anything, it's going to be a positive effect, potentially have you lose some weight, and maybe the weight loss might have you affect the doses. Okay, banana nut muffin, estrogen and progesterone normal. So yes, so that your question definitely sounds like you have stress. Lucy May's mom, 1 time a week at 5 milligrams if it's a 50 ml ball of tea, or twice a week better. You know what? If it's testosterone cypionate, so take a look at the label because that depends on the half-life. I would say 5 milligrams once a week is a great place to start. You might need to do it. I would almost, well, I mean, I guess you could do twice a week. I guess I'm just like a minimalist. I'd rather have you do a once a week higher dose injection than a twice a week. But you're right, either is fine. So is the patch metabolized better than the gel? It's not the metabolism, it's the absorption. Okay, I got told today that I have an underactive borderline thyroid. I'm just over the limit. So that means you must be over 4.5. So a lot of doctors won't treat then, and I'm hoping that they do a little bit more digging and then do a free T3 and a free T4. I have 1 out of 13 progesterone, Nellie Masters. Okay, so I think, does that mean that's a 1? And when did they check your progesterone? Was it after ovulation? Okay, I'm going to try to get through 2 more questions, and then it's going to be time for me to sign off. Any idea how I have low progesterone if I ovulate? Yeah, that's funny. I think progesterone can be affected by stress, by aging, and so you may be able to respond to Vitex, or maybe I have people who ovulate that need progesterone. I was one of them. I started taking my progesterone at 38. Okay. Wants you to start Slind for PMDD nervous. Okay, so I don't hate Slind. I use it for some of my patients. There's no estrogen in it. It's a testosterone blocker, progestin. It could work, Abby. You could also try some magnesium and some calcium. Those have also had great responses for PMS and also even saffron. Is there anything wrong with pellets versus creams? All of those, functional, glow, and pee. So it's not that they're wrong. They're just dosed differently, and their pharmacokinetics is different, the way they're metabolized. So a pellet is going to go way, way up and way, way down. So it's all about what you dose, when you check the levels. And some people do great on pellets. The problem with pellets is the dosing for some people. So I do know that some people do really well. Oh, Lucy May, you need that hug peptide. Yes. So, you know what? Someone told me they got oxytocin nasal spray at Walmart, but it was on the shelf. Oxytocin is a very heat sensitive chemical. So I don't know how they don't have it in the refrigerator. But anyway, okay. So, guys, I got one more question. Hi there, Margaret Reed. I was on testosterone cream, 0.5. That sounds like a good dose. but it caused me a rash. Is that a side effect? That seems like it's a side effect of the base. So they take the testosterone powder and put it in a cream. Ask your pharmacist. It's called an excipient. It's what the cream is. You can get a hypoallergenic gel. Okay, for those of you that were on, we had great questions. I love that you are such an informed audience. We try to be here on Tuesdays. Tune in Tuesdays when I'm not traveling. Next Tuesday, I will be here, not traveling. I'm traveling tomorrow, going to Boston. Speaking of Boston, any Boston people out there? I'm teaching doctors there this weekend. For those of you, we did check our links. I will check them here on my link tree, but you can go to my website, Dr. Tara Scott. All the links are working there for the natural therapies for antidepressant. I know there were some PMS questions today for the download on testing, all free for the free course. What else?
Questions to ask your doctor.
Oh, there's a new advocacy, questions to ask your doctor. You guys had a lot of questions on that. So go sign up for our newsletter. It's free every Tuesdays. Follow me here. Follow me on YouTube. Subscribe to my channel. Follow me on Instagram. And I will come on here on Tuesdays. I loved your questions today. And thank you for those of you with your kind words. Thank you so much. That makes me want to keep on going because it's a lot. And I appreciate that. So guys, have a great day. And if I missed your question today, comment on one of my posts. Have a great day. And thanks for tuning in. Gosh, I miss my marriage. She needs it.